Sober for life?
Proud to be.
This is an institution that is under the Methodist Church in Kenya, whose idea was conceived in the year 2018.
6 months later, the first client was admitted.
And saw an opportunity in this Methodist facility to start a rehabilitation center, because I had seen a gap in this area, that many people are really ravaging in alcohol, drugs and other substance use disorders. And when I looked around the church clergy, I realized that we were not properly qualified to handle the issues surrounding the alcoholism and drug and other substance use disorders.
Drugs and substance abuse is a problem that affects not only the users but also the entire society. Addicts are usually young people who should be participating in nation building and earning a living, but drugs have reduced them into a burden to the society.
Some start as early as primary school, others start in high schools, and it's not like they start knowing that surely they will be hooked into them. They start as social users. Social drinkers. They like in December, when the children are getting initiated into boyhood, or from boyhood to manhood, that is where the majority actually gets started. That's where they get started. They tell us, they are told, if you're man enough, puff it off, smoke it, we'll see if you're going to swallow the smoke. So that's how they start practicing, and before they know it, they are already addicted to the disease. So we go to schools telling the teachers and the chiefs and the community leadership on the effects of this social use, and some of the things that they need to avoid, like parties for young children, being out at night, children being let alone to watch TVs, watch whatever programs they want, because we have also realized TVs, movies, social media are actually a big problem to the young generations. They are having mentors who are actually, they call them celebs, people that are either ni wasanii, they call them the wasanii. And so they are like the people that they are like their role models. So we do a lot of talking on the early intervention or prevention programs, and this is where we have a lot of challenges, a lot of work.
Bishop Catherine Mutua, the founder and vision carrier of the Methodist Treatment and Rehabilitation Center, observed that the methods employed by the clergy to treat drug users were not responding to the needs of the society.
Methodist Treatment and Rehabilitation Center is here, is a professional institution, and is an institution that is licensed by all the bodies that are supposed to do so. It has qualified personnel to work on people, and I'm also here not only as a therapist but also as a pastor. When it needs prayer, we pray, because we also believe in spiritual recovery model, where we reconnect people back to God, and it is working. Actually, the clients themselves enjoy the spiritual programs that we have, including taking them through the catechism classes, baptizing those that needs to be baptized, giving them Holy Communion, because ours, though we are the Methodist Church, is a community church, is a community place where all are welcome, except of course those who are from other religious backgrounds like the Muslims, the Hindus, the Catholics, because we don't share sacrament with the Catholics. Yeah, so that's it about the society. We have some who have embraced it and they are very, very supportive. But those who have not, I would request them to do so that we are able to help and more so allow us to come to churches, allow us to come to schools, allow us to go to all the institutions. Even actually we are planning to go to the government offices in the county, so that we are allowed to talk to the police department and also the Teacher Service Commission to allow the clients to be sent here for not only admissions but even counseling programs, because people are sick. The mental health is a challenge, and this is why we are having a lot of depressions in the workplace. This is why we are having people who are actually absconding duties, and even those who are working but not delivering because they are suffering from stress and other related mental illnesses.
At the rehab center, patients are treated with utmost confidentiality and care, since drug addiction is an illness.
I have seen clients come and go, and I thank God for the far that we are today. Basically what I do here at the facility, I am in charge of the staff and the client welfare. Basically what I do on a day-to-day basis, once I arrive at the institution, the first thing that I check on is the concerns of the clients over the night. Mostly they have got their own concerns. Maybe they need something like they need to use during their play activities, and it is not there, or it needs to be provided. And basically because we train them to do the cleaning, especially in their dining hall. Maybe they don't have a mop to use or a bucket. Those are few concerns that we always raise. Basically, after the concerns, I take the opportunity to go and check the areas where they sleep. We train them the basics of cleanliness. And because when they were drinking and they were in their addiction, most of them are usually very untidy. So at their sleeping areas, we usually train them how to spread beds, how to keep their rooms neat by keeping the items, clothing and other items in a neat way. So basically when we go to the rooms and find they have not spread their bed, with love we call them and train them, especially the first few days of their admission.
Usually, clients are brought into the center involuntarily. The staff here are well aware that they are dealing with patients. They are trained professionals in their specific fields. Nurses, administrators, and counselors handle the clients sensitively so that they help them cope with the withdrawal symptoms and gain acceptance into the society.
A triage room is whereby all the investigations and all the findings are done. These include the history of the person, the presenting problem, and also the person has to be accompanied by the family members or significant others during the admission process. During admission, there is that part of history taking, doing the drug test, checking the pressure, checking the sugars, and also the presenting problem. After that, we check also whether maybe the person has underlying medical condition, which are called biomedical condition, and past psychiatric history, if the person has been to a psychiatrist before. And then after that, also the family history, background, how the family that these people were brought in, and also how is the family, and also the relationship, also the school history, the growth and development, how did these people grow, how was the environment there back at home. So those are some of the things that we dig out or we find in trying to identify what the cause of the problem. And once we are able to identify the problem, either the person has an addiction problem, has an alignment or illnesses. Some of these mental illnesses include bipolar, schizophrenia, depression. Those are the most common.
Treatment and rehabilitation of drug users is an intricate process that requires a lot of care, resources, and understanding.
Community, our nation, we are really battling a lot of mental health issues, and most of them also being drug and substance abuse, depression, anxiety disorders, all these problems that needs to be addressed. If you are not the one really undergoing through this problem or challenge, you get to understand that maybe your loved one is really suffering or undergoing through these challenges that we need to address, and see that we bring a sense of hope and healing to this source. In our center, we really make sure that we offer the most human services to people who are really in need. We have a 90 days program, the minimum period of time that we do admit our client, and this is guided by the NACANDA stipulations. And we also get to know that in this 3 months before we even take our client, we really make sure that we assess this client to know that who are these people who really qualify for an admission, what is their problem, where does this stem from, what is really bringing the root cause of this problem. All these will really advise us on what to do. And in terms of addressing this, we use various assessment tools depending on the presentation of the client. We also do a drug test or a screening for drug tests to also know that what specific drugs might this client also be using, and other assessment tools that we use like assist, audit, and cage to really establish could this client be having a problem, and if the problem is there, how can you really help them. This brings us back now to the modes of admission that we have. We have the involuntary and voluntary mode of admission. Sometimes we get clients who are not willing really to join the program, but the push comes and the love comes from the family, where they feel that they won't watch their loved one really sink to depression or sink to alcoholism or hit the bottom. They need to do something about it so that they can help them.
Sober for life.
Proud to be.
Proud to be.
Sober for life.
After 5 years of operation, the Methodist Treatment and Rehabilitation Center now boasts of success stories of drug addicts who have successfully been rehabilitated. Such stories are of Winnie and David, who are among those who were treated at the MTRC and are today living their full lives.
I am a rehabilitated addict, so many times in psychiatric clinics, and this rehabilitation I passed, and the biggest addiction that I had not been able to stop was mogoka, and I had comorbidity of so many drugs, alcohol, mogoka, Meru, bangi and cigarettes. My journey started when I finished Form 4. I was taught about marijuana, bangi, na cousin yangu alikuwa anaitwa Mwega, but unfortunately he died last year. He died from a very bad accident at Chogoria. And when I finished high school in 2007, I started working for my friend in a pub. He owned a wine and spirit, and I was there selling alcohol. And there was a crowd of youth who were coming to drink there, partying and everything. And I got influenced so much because I admired the way they were having fun. There was a crowd of 3 girls and 4 men in that crowd. I was so curious, and I was so interested in joining them. And that when I first encountered bangi. The first experience was so sweet and nice. I smoked it and I laughed myself silly. I laughed and laughed and laughed and laughed, and the euphoria was too much. I was so happy having smoked it, and I loved it so much. Most of it all, I would encourage anyone to come to rehabilitation to gain their senses, to gain that peace of mind, because when you're intoxicated, when you are addicted, you cannot do anything and succeed. It is a rush to nowhere.
Yeah, so I smoked heroin, was in and out of rehabs. Of course, I now totally dropped out of campus, and we had issues at home. My parents would even really argue because of me, and basically, mostly in my 20s, I think most of my time I've spent in rehabs. So yeah, in 2022 January, I went back to school. I thank God because I passed my Form 4. So yeah, my dad even went and applied for me, and I joined the Kenya Methodist University, and currently I'm pursuing a degree course in counseling psychology, and I'm currently finalizing my second year. Next trimester I'll be joining my third year, and I'm grateful to God. And actually right now I'm writing my research project, and my project actually is based on addiction and the recovery and the best models, because in the treatment process there are many models, and my heart really goes out to people who have addiction issues, because I've been in those shoes. I know where they hurt the most, because people have stigmatized, people have given up on us, people have called us names, but I know recovery is possible. It is possible. A day at a time, you put God first, you celebrate. I celebrate my small wins. Yeah, and I still journey on. It's not like just because I'm sober that I don't encounter challenges. I do encounter challenges. But what's different is the way I deal with the challenges. Before, if I encountered a challenge, I'd go back to smoking heroin. I remember, because I have smoked cigarettes for 16 years. Every time I got angry, the first thought that would come to my mind was me to go and smoke a cigarette. But that no longer happens nowadays. Nowadays, I have unlearned those maladaptive behaviors, and I've now learned adaptive behaviors that can help me now cope with life, because life will never be a road in the park. Back in active addiction, I used to think to myself that life is so unfair, because only us people that are in addiction, life is so hard for us. But I realized life is hard for everyone. It's just that the way it's the way you look at it and the way you decide to resolve your issues. Like now, when I have issues, I love listening to worship music. I listen to worship music. I pray about it. I journal. I even call somebody, because I still call the director. I talk to her. And yeah, I'm grateful to God.
Drug addiction is a disease, a ticking time bomb in the society that needs to be dealt with.
People have gone into drug use and substance disorder. They have gone to alcoholism and the other support that will require. I personally would want to talk to the administration of this country, the administration of this county. Please help us to get the pubs out from the communities, because we have pubs right within where we stay in the neighborhood. Children can access alcohol from the neighborhoods where they stay, and this alcohol, some of it is not clean. I wouldn't say I'm advocating for any form of alcohol, but please get the alcohol out of the communities, so that at least those who need it can go to look for it in town or where it is available. The other thing, I would talk to the administration. The people that sell marijuana to high school students. The people that peddle these drugs to university students. our universities, our children are using these substances, and the administration, you know the people that peddle these drugs around. I'm requesting you, please come on board and help us, because it doesn't make sense that the student can access marijuana before they go to class, the student can access alcohol before they go to class, and you know these things where they are, the people who sell them, the people who peddle them, and you do nothing about it. So I'm requesting for that partnership as well, so that as we treat, we are also doing preventive approach. Sober for life.
Proud to be.
Proud to be.
Sober for life.
Sober for life.
Proud to be.